We did a biopsy, and they showed there was cancer in the prostate.
When explaining to patients a serious condition and their options, it can be frightening for them. Urologist Dr. Abraham Hawatma tries to give his patients all the information they need to process and understand.
And that kills the cancer.
Wanting to be demonstrative, this is the way he used to explain things. After going through a lot of paper over the years, Hawatma had an idea to form a company, creating technology that can help doctors and patients. He shares his practice at South County Urological with his urologist son, Dr. Salim Hawatma, who is now his chief medical officer, and he wanted his daughter to run the show as CEO.
As you can imagine, working with your dad is probably like the best thing that could ever happen to you, right? Because you get to spend all that time with your father, which, you know, it's wonderful for us, for me and my brother. But beyond that, he's so talented and he knows so much, and it's just wonderful to be able to put that into something that can be shared with everybody.
It was just a matter of getting it done. The family approached Seth Krause, a family friend with the right expertise.
And Seth said, well, it can be done, but it's difficult, and you know, it's going to cost a lot of money, and this. And I said, Seth, can it be done? He said, yes. I said, do it. That's it.
Knowing how heavily regulated the healthcare industry is, there aren't a lot of technology companies that are out there taking risks.
Krause says that gave them the opportunity to build this application. The family and Krause formed Digital Medical Arts. The company created Max, a patient education software platform.
Stones, incontinence in women.
And under each of those treatments, there's technologies. And under each of those technologies, there's imagery and videos. That is my responsibility as the technology lead, to understand the clinical side of it and to translate that into a layered technology that can be built in an application.
It's also designed to be personalized.
In the prostate cancer section, we have a link to a nomogram, which is a predictive tool, and we can type in the patient's specific information, and it gives us survival statistics, and it helps patients make better decisions. You know, if you had surgery for this type of cancer, this is the outcome from a cancer-specific survival you can expect.
Patients at South County Urological were the first to benefit. Now, Hawatma can explain procedures in a way patients can really understand and hopefully not be afraid.
Like a ball that touches the skin of the side where the stone is and shattered it through the ultrasonic waves.
Helping prostate cancer patients as well, like Aaron Darnell.
Like if it's 3 here and plus this one here, 4, then it's equal to 7. This is how the cancer, aggressiveness of the cancer. Robotic removal of the prostate, which is the surgery. We use the robotic instruments and we remove the prostate. We protect the nerves.
It's one thing to sit here and tell you, okay, we're going to do this and this and this and this. But when he's showing you exactly, it kind of helps you with questions that you might have had. Or you think, nah, I should ask him about this, or I should ask about that. So I think it's a great tool.
A lot of the doctors are in such a hurry that they come in, rattle it off, go out, and okay, we'll see you in a week or two. We'll get it scheduled, you know, and you're thinking, what?
They say the software empowers patients, giving them confidence and comfort with treatment decisions. And physicians can use their time more efficiently. Digital Medical Arts claims to be creating a new standard of care, revolutionizing the doctor-patient consultation.
I want every doctor, every orthopedics, every cardiac surgeon, every gynecologist to have this.
We have the platform now. You know, we just need experts in those fields to just plug in additional information, drawings, videos, whatnot. But the template exists.
The severe pain was caused by a stone in the ureter or in the bladder.
For Hawatma, just the thought of explaining treatment of ureteral stones with a Sharpie and paper seems like the Stone Age compared to what he's using now.
That at the end of my discussion with the patient, I push a button I give him a copy of everything I said.
The Darnells say the technology helped them decide to move forward with surgery. 3 years after the procedure, Darnell said he's cancer-free.
I just think that it's wonderful that a doctor took his time to do this, to make it easier for his patients to understand and their families, that my hat goes off to him.
For HEC, I'm Kathleen Berger.
And we saw everything back together.